Time now for Morning Rounds, our look at the medical news of the week. The number of measles cases in the U.S. continues to rise, now with the most infections reported since 1994.
According to the most recent data available from the Centers for Disease Control, 704 cases of measles have been confirmed in these first 4 months of the year. That is nearly double the number of cases from all of last year. Here to discuss this and more is CBS News medical contributor Dr. David Agus. Good morning to you. Please remind us, why are measles so dangerous? Because maybe that message needs to come home.
Well, millions of people died before the vaccine. There were several million deaths a year across the world. This vaccine has saved in the United States millions of lives, and now there are pockets that aren't being immunized. So that number of 704, the CDC data come out every Monday. So this Monday, that data will be dramatically higher. You know, the vaccine came out in 1963, but the first years of the vaccine, it wasn't as potent as it is today. And so people born from 1963 to 1968 may need a second booster. That includes the two of us, Anthony.
I'm on the list.
And it wasn't until 1989 that we gave the 2 shots that confers pretty amazing immunity.
And with that, I mean, children are supposed to get those 2 shots for the MMR vaccine. But if you're an adult, should you be thinking about getting another vaccination if you're not sure if you've even gotten those first 2?
The answer is yes. So if you're born before 1957, you don't, because everyone got measles then. But after that, if you don't, none of us have our vaccine records. We're not sure if we got the good vaccine or the big vaccine. You could get a blood test that tells you how your vaccine is. But the bottom line is the vaccine is probably cheaper, and there's little downside to getting a booster of the vaccine. You know, we don't give it to kids till age 12 months. So I know parents that are afraid to go out now in New York City in the subway because they're afraid someone will cough on them and they'll bring it home to their newborn and give them measles. It's a scary time.
And a lot of those cases were in New York. Out of the 700 plus, many of them are.
Yeah, we blame New York for a lot of things.
It's our fault. David, so what should public health services take away from this spike in cases? What do they learn from this?
I think this is a watershed moment, is that we really have to push to vaccinate children, not just for the child, but for the community. We're all living together, and we have to take care of each other. It's like secondhand smoke. You know, you affect other people, and that's what got people to stop smoking. My hope is this is what really brings up vaccination rates to we're all protected.
Okay. Next up, electric scooters. They're becoming increasingly popular in cities around the country. What's less well known is how many bumps and bruises and even more serious injuries they're causing for their riders. The Austin, Texas Department of Public Health, with the assistance of the CDC, launched a study to examine the public health impact of scooters. What did they find, David?
It's an amazing study. I mean, to me, it's amazing because about 1/3 of the people who had injuries, it was their first time riding a scooter. 2/3, they had only driven it a few times. So what that means is we're not educating people well. There's a video you're supposed to watch, but how many of us look at the introductory thing, read the disclaimers, watch the video? First of all, we need to educate better. And in that study, only 1 person was wearing a helmet.
Oh, wear your helmet. I mean, that's a given. But what about that education? What can riders do to be safer?
Well, the scooters are great, right? In that, you know, there's no emissions, you know, get people out of cars, you're out of doors. I mean, they're all over Los Angeles where I live. But we need to do it safely. And you need to do it with a helmet. You need to do it in the right lane. And, you know, they go up to 15 miles an hour, so they ain't slow.
Right. Yeah.
So we may need to temper down the speed a little. But I think it's going to be great for transportation in cities going forward.
All right, finally, building blocks for building skills. Lego recently announced support for a project to help blind and visually impaired children learn Braille in a unique way. The textured knobs at the top of the Lego bricks will act as Braille dots and will also feature a printed letter or character so both visually impaired and sighted children can both play. The Lego bricks are currently being tested in multiple languages, and the final Lego Braille kit is expected to be available sometime next year.
I love this.
Yeah.
It's amazing it hasn't happened till now, but it is brilliant. We have to bring back Braille. Apparently, you know, people aren't learning Braille anymore, and we have to.
Audiobooks, right?
Yeah, because books matter.
Yeah.
And based on that article, I think they said 10% of children in this country who are visually impaired know how to read Braille. Only 10%.
Well,
kids need to read. It's great.
And kids love Legos, so that's a good one.
Yep.
All right. Thank you, Dr. Agus.